everyone, and welcome to my Facebook Live this week. Binks and I are going to show you today what I call the scruff substitute. Now, one of the biggest challenges sometimes for handling cats is stopping, getting away from grabbing at the back of the neck, and what we call scruffing. Okay, I'm going to use my stuffed cat because I will not do this to Binks. But this is where many of us have been taught for holding a cat or preventing a cat from aggressing, like when giving an injection or doing an exam, is to pinch the skin at the back of the neck. This is called scruffing. Now, we want to get away from this. Why? Because it's actually unpleasant for the cat. It is not a part of the natural, behavior or what the mom cat does for an adult cat or even a kitten over about the age of 8 weeks, after weaning. And it is really, if you watch and you look at these, cats who've had a lot of scruffing, how they now respond to any kind of touch, the cat is associating the pain and the fear with having, the scruff applied to any kind of hand touch, which sets us up then to the cat we can't hardly examine, and then the client is not bringing the cat in for care. And this is why many of our cats may have had, their spay, neuter, first exam, vaccines, then we don't see them for 10 or 15 years. And at that point, then a lot of them are starting to have already aging problems and aging disease that's become advanced. And so we're going to get away from that. So we're going to start here with the scruff substitute. The scruff substitute is, and as you can see, I've got Binks up here on my exam table, and we're going to work with them up here. So anyway, a scruff substitute is the same as the cowl technique, C-O-W-L. And the cowl technique, there's information about it in Dr. Sophia Yin's textbook. It's now become pretty much, I think, a common handling technique. I have a couple videos on my YouTube channel. But cowl means turtleneck. Sorry, not wearing one today. And how we do this is we're going to take either towel, and in this case, I like using pillowcases just because the pillowcase, especially for cats and small dogs, this technique is also excellent for our push-faced bulldogs, stay up here, buddy, Lhasa Apsus, Shih Tzus, pugs especially, because it's not compressing on the airway at all. But in what we're going to do here is taking the pillowcase, and you can even take, say, 2 to make it a little bit thicker if you have a larger cat. Binks is a moderate-sized cat. And I'm going to roll this up into a roll, okay? Now, as you can see, Binks is enjoying his canned food up here, which is, what I do, so he likes being up here. And, this can be used, this technique can be used for cats that either, may head flip to attempt to bite for injection, a cat, or because our handlers and the doctors may be concerned that, hey, I don't trust that cat, or they're nervous about the cat not being touched at all. I know a lot of cats do better with no touch at all, yet this is a transition for our veterinarians and veterinary technicians to stop scruffing. So this is a way that we can use this where the cat won't feel any pinch. Their head is now limited in the ability to turn around and try to bite. So, it can also work for helping everybody be more calm and more relaxed, that we're not concerned about possibly being bitten, or the cat may have pain. Cat may have an injury to the eye, they may have some bad teeth, or you could just tell they're doing that flinching. It's like, okay, you're touchy about the head. So where do we start? If the cat will take food reward, great. Give him a little bite or two. Here, buddy, I know I'm getting your position here. A bite or two of the food reward. So he likes being on the table. Roll up your either towel, or in this case, it's 2 pillowcases together. Your hands are together. And it's important that we pass at the height of his ears. You saw that? I know. I'm going to get you over here because I don't want you to scooch off. I want you to show this again. My hands are up here. See, my hand is at the height of his ear. And get your little friend off the table so people can see. And then I'm going to pass right around real quick. Now my 2 hands are together, and now I just twist it so I have a way of holding it. Let's show him Binks. So as you can see, the anchor point is similar to scruffing, but he is not being pinched. And you're going to get some nummies. You don't want that? He does maybe. Okay, now he's eating. So the point is that as I have him held like this, he is getting rewarded for it. Now I have, see, let's get this. I don't have this that tight. There we go. Now I want you to notice my forearm. Two ways that he can be held, restrained, is my forearm comes along the side of his body and he's against my body. This is how he's being held. There are 0 hands on him. Another way is align the forearm along the spine. Let's keep this in alignment here. And this helps to keep, gets him into a sit. And that also helps him to hold his body still. Now someone else could be listening to the heart and lungs, doing an injection, and I have control of the head. See that? If I need to raise him up or if I want him to lay down, I just put a little pressure on my forearm and he lays down. Okay, now that's pretty thick, and think of it like a cervical collar, you know, like a whiplash collar. It is filling the space from his jaw to his shoulder, and that is what prevents him from being able to flex his neck, you know, or really flip to bite readily, okay? So this is called the scruff substitute. Now some cats, you can see Binks's tail is flicking a little bit. He really doesn't, you know, he's never been scruffed. He doesn't always like stuff around his neck. I mean, he's okay for it. He is taking reward, and sorry buddy, that's how you earn your keep here with me, being a model for these things. So let's just say, again, paying attention to their body language. What is the response when you do try a handling technique? Let's say he kept really backing up and the tail kept flicking faster. You have to say, whoa, whoa, whoa. You don't like anything around your neck. And even the cowl technique can sometimes be a trigger for stress on cats who've been scruffed a lot. Because any pressure around the head or neck, they're just like, no, you are going to scruff me. It is going to be forceful. I hate you. You know, it just is a big elevator for trigger for them. So going back to our handling techniques, you have 2 tries and 2 seconds of escalation in the cat before you have to bail, before you have to stop what you're doing and recess. Okay, so let's imagine, you know, I come around like this with Mr. Binks, and he really kept backing up. That's why I got to go, okay, stop. Whoopsie. You know, I'd have to say stop and set that down and think, want to have some kind of way to control your head so you don't flip it around. A lot of hands on your body agitate you, so trying to get you in a cat bag is not going to work. What else could we use? You know, wrapping you in a towel is also a lot of flipping and rolling around on the body. Probably not going to like that. So what other tool could we use that would say shield or shroud? Let me just give you some of this because we're talking. Shield or shroud those front paws so they don't strike, and give me some kind of way of like anchor on your body. Okay, and again, this would be a cat who is not, now he's wearing a collar, but he's not wearing a collar, and he's not wearing a harness, and again, he doesn't like touch and handling and all these things being touched on his body, so this is not the time to try to get him in harness. And trying to put a muzzle on him may be a little bit tricky. Maybe you can pop that on real quick, but if it's, you know, you could just tell anything approaching the head, he backs up and starts doing all this. You have to say, woo. Don't think we're going to try to muzzle, because once you get the muzzle on, the cat may really get agitated because they can't see what's going on. Okay, so alternative 2 is we have our trusty towel on the table. Remember I said part of protocol with all feline handling, and you're going to learn this weekend at my handling workshop Sunday, the 23rd. It's worth 7 hours of Race CE. This is a live handling workshop. Sorry you can't be here in person, but I'll be like this on live webcam. We'll get some PowerPoint presentations, but a lot of live webcam, and you can unmute yourself, and you can even share your own webcam, like to say, is this right, or ask questions, etc. Anyway, protocol for the cat exam. We have the towel already on the table, and it's already been sprayed with you know what, feel away. So in this case then, we would position our kitty like so, and you can even give him a little nummy for being positioned like so. And you're going to take one of these plastic, people call them chip clips, okay? For the towel, not for the cat. I have to make this absolutely clear. This is not, no, not going on the cat, is to hold the towel, okay? So I'm going to have his butt against my abdomen. I'm going to take the front edge here and the front edge here. Whoa. Front edge here. And isn't this real life, huh? I know. You want to get off the table to run around here. Okay. So we're going to come up real quick like that. I don't know if you saw that. I am using my forearm against his body to limit his movement. Okay? I am not doing a lot of touch, and I just quickly bring the towel up like so. Okay? Yeah, so we quickly bring the towel up, I know, like so, and then we're going to take the clip and clip it only on the towel. And this is what can now shroud his front legs, and I could hold like this, and I'm getting a similar benefit, you know, as the cowl, in terms of I have an anchor point on his body, but I am not scruffing him. I am not pinching his skin. I am not, my hands are off of him. There are no human hands touching this cat's body. I really want you to grasp this concept of this is the hands-off handling, but when you do have to have some kind of restraint or limit on his movement, how do you do it? And how do you stay safe? Okay, so I've got this. So this way I could use this, see, for moving his body around. His front legs are shrouded, but he's not wrapped tightly. Remember, he's the kind of cat who doesn't want to be wrapped tightly. And so now if we need to draw blood, we would go ahead and raise the head for blood draw. If we needed to do an intramuscular injection, this could be given this way, and we would move the cat away from the person who gave the injection. Okay, so these are the cowl technique is what we wrap around the head, and we'll let him down to run around. You just finally had time to play today. I'm going to give him some of his lunch too. He hasn't had lunch yet. Anyway, the cowl technique is where we're going to take one or two, and I like the pillowcase because of the length and the size of it. If you have a fat cat, you know, a thicker necked cat, you could use two together. We're going to roll it up like a tube. Get my stuffed cat here. And we take the two ends together at the height of the ear, or like the height of the top of the eyes. Come quickly around the head and face. Twist. Hold at the base of the neck and keep that forearm in line with the spine or across the side of the body to hold next to you. This is the proper way to do the scruff substitute. If your arm is elevated, they start fishtailing and gator rolling. So this is why each step of this technique is important. Getting it eye height, don't have it too low. That's when they put their paw in or they duck their head and you miss. So you can have it up at the eye or the ear height. Come around real quick, twist it, and get your hand right down on their body. Your arm right down on their body and slide it to you. Now, of course, you're working on a towel already. I know this is kind of a mess right now. But you're also on a towel such that when you do this, if this cat starts trying to back up, you'd say, okay, stop. We'll give you about 5-6 seconds to de-escalate. Give them that de-escalation time. They go, Another way to hold your body without you feeling held is, let's see if we can rotate you and then quickly come up underneath the head and neck with the towel and take the chip clip on the towel, not the cat. So now we have that base to hold from without as much neck pressure. The front legs and body are shrouded, so they're not going to be clawing. And again, we can use the cat against our abdomen and our sides for positioning. Okay, thank you very much. I like to suggest using this scruff substitute in shelters, especially for the veterinary students in the veterinary schools, technician schools, and in practice where we may have experienced assistants, experienced technicians, and veterinarians who have become very accustomed to scruffing the cats as a way of restraint, and either it's habit or it's what the only technique they ever used, and it's really hard to stop scruffing, okay? So think of it as kind of a bridging technique for having that still ability to restrain the head without pinching the skin. I found this to be a lot of people who are just either they are resistant to not scruffing to go to this technique, and it becomes then that transition, if you will, that bridge over into less stressful handling and feline friendly handling without it having to be, such a black and white, either we're always using scruffing or we can't use it at all. It's kind of a middle point, and it is another tool in your toolbox. Thank you very much. I hope some of you Guys can make it to this weekend's workshop. We've had some people register. Registration is still open. There are discounts for the fear-free certified professionals as well as low stress handling certified professionals. Just message me on Facebook or send me an email and I will give you the discount code if you are fear-free or low stress handling certified. It will be recorded. So attendees, now you have to attend it live in order to get the race CE, but you will get the full recording, handouts, and a year of support for any aggressive handling cases from myself. Thank you very much. It's great to see you all again. Have a wonderful week.